Hello, everybody. My name is Dr. Emery Pitcel. I'm the owner and chiropractor at Rothrock Chiropractic and Rehabilitation here in State College, Pennsylvania. And I gave a presentation recently at our networking group, BNI Business Networking International, and it was on two cases and our logical referral asks that flow from those two cases. So let's, without further ado, dive right into it. I want to thank everybody for watching the video and for taking their time. This should be about 10, 12 minutes, and we hope that it's helpful. So jumping right into it, whenever we are working with patients and helping to solve their problem and get them out of pain, it's kind of a lot like a detective, where we got to figure out what the problem is and come up with solutions. So our first case here, the background on it is actually a 68-year-old female that was having mid-back spasms. Now, it's neither of these two people in here. Actually, this is my mom and this is my grandma. Now, I'm not going to reveal what their ages are. I think they both appreciate me for that. But let's just say that this lady that I'm talking about falls between their two ages. And then they are playing Candyland here with my youngest daughter, Reese, and my oldest daughter, Aubrey. But back to the matter at hand. This lady that came in, 68 years old, was having consistent mid-back spasms. They were like 10 to 15 years in duration, on and off pain. And she believes she had like a bicep tendon repair surgery and just never felt the same after that surgery was performed. On and off symptoms and the mid-back spasms, she would usually get like two, three, 4 episodes per year, enough to get her attention, but never enough to really hold her back. That changed in the last 2 weeks before her appointment because now she started having 2 to 4 attacks per hour. Spasm attacks that would last 30 to 60 seconds and really kind of made her feel like she was being held back, like there was a monkey on her back, and that she, was just being completely limited in what she was able to do. And it frustrated her to no end. That's why she sought us out for some care. To add injury to insult, she also was being impacted at night because it was diminishing her sleep and she was not sleeping well on top of it. So that's the background of this first case. The pain and the limited activities of daily living that she had. First of all, she felt that if she was sitting for long periods of time, that the spasms got more intense and lasted longer. So she felt like she had to keep herself on the move. But however, if she was trying to do something like clean her house, then that leaning forward and like, wiping stuff out in front of her and that repetitive bending load also made the spasms more intense and worse. Additionally, she felt that laying down, especially on her sides, was really painful. And so that was a problem for her with that. And then she was also really trying to get back into some physical fitness and getting back into shape after the COVID pandemic and wasn't able to because workouts were making her pains intensify. Now, it wasn't all bad news for her. She did find that if she was laying over a foam roller a time or two a day, that would cut the spasms and improve her pain. And if she spent some time laying on her tummy, kind of like these beautiful dogs were right here, that also kind of cut some of her pain as well, too. So how did we solve this problem? Well, the very first thing we did is we kind of told her that she was kind of on the right trail with the foam roller, but she just wasn't doing enough volume and enough reps, and she was going to do better for herself if she took the foam roller from the ground and moved it onto the wall. Because we did a McKenzie Method assessment, and we determined that foam roller extensions on the wall were her directional preference. So here's kind of a quick demo of how these are done with the back arch over the wall for about 2 seconds and releasing back forward. And that was enough to take pressure off the disc, off the thoracic nerve sleeve, and off the muscles. And immediately, just with doing that exercise, she was starting to control her symptoms and control her spasms and irritations. We didn't just stop there with the exercise, though. We also provided her with soft tissue massage in office, specifically pin and stretching while moving the shoulder and the arm and using the flexion distraction table piece to really kind of get blood flow and calm down the muscle tension. And we also performed thoracic spine adjustments to kind of help her get movement into the back and once again cut the spasms quite a bit. And really, that those are the three pillars of our approach of treatment here at Rothrock Chiropractic and Rehabilitation. There's an exercise component to it, muscular work, and the adjustments. All three of those really help this patient to get her symptoms a lot better. And last I checked, she's got a lot more control over her symptoms than she did before she came to see us. So that's fantastic to hear. The referrals that flow from this case, certainly if you know of a geriatric individual in Center County, Pennsylvania, or Central PA in general that is struggling to get themselves back into shape because of pain that they're having, or maybe they're struggling with an activity of daily living, such as cleaning their own home, or it's springtime, maybe they can't go out to fish because of pain. whatever have you, send them our way so we could try to help them get them back to functioning, get their pain back under control. We also love asking for referral sources. So if somebody knows a good, valuable contact at the YMCA here in State College or one that's in Center County, we'd be happy to have that introduction and see if we could sit down for a cup of coffee to figure out how we could collaborate and work together to improve the health of our elderly. Same thing with the senior living center, like thinking specifically Foxdale Village here in State College, but any senior living center, we'd be happy to have a contact and once again sit down and see if there's ways that we can work together to help their clientele and our patients. So we are going to take a brief intermission here now that we are about halfway through the presentation and we got through our first case. Now, as a chiropractor, I preach to people all the time, you shouldn't sit for a very long time. So if you're already to this part of the presentation and you have been already sitting for a while before coming upon our video, then you need to stand up and get yourself moving a little bit. Or if you don't want to stand, I'll level with you. How about a little bit of shaking the hips and kind of stretching and doing a little bit of swaying and dancing? Here are my two absolutely crazy, adorable daughters just dancing in place and moving themselves around a little bit and get the musculature relaxed, get that tension out of the tissues, and get yourself kind of loosened up before we continue on with our case here. So enough of that. I don't want to get too distracted at the intermission point here. We are going to move on to the very next slide here, which is to go into our second case, case number 2. And once again, putting on our detective hat and trying to solve a problem for a 22-year-old male that was having groin pain as a result of a running injury. In the world of athletics here, here's my oldest daughter learning to ride a bicycle. Go little athlete her, right? But this was a little bit more of a serious problem for this individual. They were injured in a 10K race on outdoor track in early March, and they were being seen in January. So the injury took place 10 months earlier. They, along their journey, went to a sports medicine physician. They got an MRI and were diagnosed with sports hernia. But unfortunately, none of that was early enough to create some sort of changes to get them back to racing and running again. So they unfortunately ended up ending their college running career on an injury. They missed the rest of outdoor season. It was their 4th year of running eligibility. So they ended their career with an injury post race. And I know that individual felt that their life was kind of a mess. Their running career was a mess, kind of like my older daughter here with Oreos all over her face and all over the place. It was just a hot mess, right? What were the pain and the limited activities of daily living? Well, obviously, running, but specifically, every heel strike that would happen landing out in front made this person feel like they were getting stabbed with a red hot poker right in the groin, right below the pubic bone. Sounded immensely painful. This person also couldn't run more than a half mile without pain, whether it was jogging or full speed. So not being able to run for more than 3 or 4 minutes was very problematic for them. And as a result of all this, they legitimately were fearful that they would never be able to run a race again or run competitively or run for enjoyment. And that really kind of turned their world upside down on them and made them feel really sad. So how was this problem solved? For this individual, they worked a lot on eccentric lunges, first starting without weights and then adding weights as tolerated, but starting in a split stance here and taking a good 5 seconds to slowly drop into a side lateral lunge. So that way the adductor muscles here where the injury was living at was able to go under strain and get remodeled at the tendon and the muscle and bust up the adhesions and the knot in there and get a good hard neurological reset to those tissues in there. And then once again, weight was added over time, but this was a critical exercise for this person to get themselves rehabbed and better. Also, with their appointments, they had a lot of soft tissue massage performed, a lot of pin and stretch in the front and the interior of the thigh, which is really painful to get in there and break up that knot, but necessary. And then hip and lumbar spine adjustments were also a good collaborative piece for there. So once again, those are the 3 pillars of Rothrock chiropractic and rehabilitation therapy, right? An exercise, a muscular component, and then the hip and the lumbar spine adjustments. Except for, I misled you all a little bit. This was not performed in our office. It was performed at National University of Health Science Student Health Clinic, which is the chiropractic school I went to in Illinois. And that was done in January of 2014. And I was not the provider. I was the patient, right? So here is my wife and I, younger versions of ourselves before we were married when we were in college. This is actually a picture of me running at Grand Valley State University. In Michigan. This was my fourth year of running and cross country season right there. And so this was a real story. I was truly fearful that I would never be able to run again because there was pain every single time I went back to get into running. But by going to the chiropractic student clinic and getting these tools and getting these treatments, I was able to get myself back into function and run 3 marathons when I was in chiropractic school, all 3 of them here with my younger brother. And one of them was the Boston Marathon in 2017. And you see my wife and I here during that one. So my livelihood today is chiropractic, but I have a lot of my life back in the running world because of chiropractic. And that experience that I had going to student clinic and getting myself back to functioning, getting back to something I absolutely loved was just so invaluable and really kind of ingrained in my brain there that I was in the right profession to make a difference for people. So the referral asks that flow from this is I'm looking for athletes that are struggling with an injury. Maybe you're fearful that their season is going to end or their career might be over, kind of how I was afraid as well too. I especially love working with runners because since I ran college cross country track and field for 4 years, I feel that I have a lot more than just a clinical skill set, but I understand training skill set and how to eat and how to train and whatnot. And I'd love to be able to help more runners in our community. Um, and then the referral sources once again too. So looking to be connected with more personal trainers in gyms that are working more with our athletes so we could collaborate to keep them performing at the gym. And I'd love to connect with coaches here in central Pennsylvania, especially in Center County here. If we could get a coach, definitely that's with the track and field program at one of these schools, that would be just absolutely ecstatic to work with more of their athletes to keep them healthy, keep them performing, and hopefully be proactive to prevent them from getting problems in the future. So those are my specific asks from there. I want to thank everybody who made it to the end of the presentation. Thank you so much for your time. I appreciate your attention. I hope that this was helpful. We are indebted to the community for the support that they've provided for us, and our ability to grow as a practice has been directly because of word of mouth and because of your fantastic efforts in telling people about the good work that we're doing here. But this is a recap on our referral asks, once again, from case one being geriatrics and the connection with YMCA and the Senior Living Center. And then the second one being an athletic case and us wanting to be connected with more personal trainers and more coaches in the area. My daughters want to thank everybody for supporting our business. My wife thanks you. I thank you. The entire office thanks everybody for all the support that they have provided for our practice. And we are happy and indebted, and we love paying it back forward with referrals to other small businesses in the area, and just helping everyone to the best of our abilities. So, but thank you so much for watching and sticking tuned to the end of this presentation. We really appreciate everybody. And with that note, we're going to cut the presentation now. But thank you so much for watching, everybody, and take care until we talk to you again next time.